In this video, I will be showing how I would use the flipped classroom method in my athletic training class. Okay students, welcome to Mr. Giovannucci's athletic training class wiki page. This is where you will find all your presentations, work, homework, announcements, and anything I mentioned in class. Today we'll be covering lesson 1. Lesson 1 is on-field emergency management of athletic injuries. You will be reviewing the PowerPoint and come to class prepared for hands-on learning of the lesson. We will be doing hands-on activities in the classroom to deal with this PowerPoint. Do the activity at the end of the PowerPoint and prepare it to hand in at the beginning of class. Each student has specific scenarios also located in the PowerPoint. Come with questions and be prepared for class, and take time reviewing the material. You can review as many times as you want. Also, the most important, enjoy. Okay, I will now be going to the PowerPoint. Make sure you download the PowerPoint off the wiki page. You can also follow along with me. Okay, so starting off, on-field emergency management of injuries. First we want to look at pre-event participation. We want to look at the 7 P's. This is the most important part of this preparation. The EAP is the designated personnel, EMS route, emergency equipment, telephone location and number, and communications plan. These are all designated at the beginning of every event for every event facility. The 7 P's is proper planning prevents piss poor performance. Emergency evaluation. Notice your patient's ABCDEs. Okay, airway, breathing, circulation. Airway, you want to check 5 to 7 seconds. Breathing, 5 to 8 seconds. Circulation, heart check, 20 to 30 seconds. Blood loss, 20 to 30 seconds. Neurological injury, 10 to 20 seconds. For a total of 60 to 95 seconds. Now, think of any life-threatening emergency situations that you could come up with at the top of your head and list them out. Okay, priorities and management of injuries. You gotta look at the highest priority as respiratory, cardiovascular impairment, facial, neck, chest injuries, or hemorrhages, either external or severe. The priorities, like I said, the most high priority ones are peritoneal injuries, shock or hemorrhage, cranial, cerebral, spinal cord injuries, open or closed, and severe burns. Low priority more is like lower GI tract, hemorrhaging, peripheral injuries, open or closed. This is arms, legs, stuff like that. Minor face and neck injuries, and cold exposure. Special priorities are fractures, dislocations, orthopedic injuries, tetanus, and other exposures. Check the level of consciousness and posturing. Always, this is the most important to check in the beginning of your evaluation. You want to check if they're alert, verbal, if they come with a painful stimulus, or they're unresponsive. Check for breathing patterns, the quantity of their breaths, the quality of breaths, and the different breathing techniques that we covered in class. Okay, this is just a review of what we covered in class, so review this as many times as you need to, and really understand the types of breathing. You have to notice this when you approach an athlete that's down in the field. Okay, look for an obstructed airway. Look, these causes can be compression of trachea, tongue blockages, foreign bodies, tissue swelling, fluid in air passages, harmful gases or fumes, suffocation. You want to look at the circulation. Are their hands blue? Is their mouth blue? Also the temperature, their pulse. Notice the different pulse rates at the different levels that you check the pulse. You want to look at for bleeding and notice what type of bleeding, what color bleeding, or the flow of bleeding goes with what type of injury. Signs and symptoms of shock. You want to look for a weak rapid pulse, cold clammy pale skin, all the signs and symptoms. Make sure that you continue to look for all these as you're assessing your patient. Some types of shock that we also covered in class. Make sure you know these to the fullest, and you're aware of how to tell these on for your athlete if your athlete is experienced in any of these. Okay, you want to look for cerebral spinal fluid from nose and ears, pupil reaction, and do a secondary survey of the body. Go from head to toe. You want to look at the different causes of unconsciousness. Also, diseases that the patient might have had prior. Look at their habits, whether they're alcohol drinkers, drug addicts, and if they're allergic or anything they ingested anything poisonous. Here's some YouTube videos that you can look on to tell if they're having seizures like epilepsy and the different types of seizures. Make sure you review these. To tell for stroke, you want to look at the cardinal signs, which is also called FAST. You look at their face, arm, speech, and time. Okay, now your activity. Make sure you review the PowerPoint and also your notes on the PowerPoint that we covered in class to follow up with all the things we learned. The activity, you're going to provide primary care for a following victim that I will give you in this PowerPoint. Reflect on the following, review the situation, write out management procedure, identify the injury, explain how an athletic trainer would handle the situation, and identify any differential diagnosis you might have. Make sure you prepare this and bring it to class and turn it in at the beginning of class. You can prepare this as a PowerPoint or just a written document. Have fun and be professional with it. This is a bonus. You can also do this one, and this will get you some extra points in class. Brian, you have this scenario. John, here's yours, and Jared, here's yours. So this is how I would conduct a flipped classroom method. I would give them their lesson, tell them what they need to do, give them a short PowerPoint on stuff that we have all previously covered in class, and then have them prepare themselves, do a little homework assignment, and bring it in and be ready to do hands-on experience with this in class. Also, this prepares them for clinical scenarios that they might have this. They might be at a sport and they will have to look at athletes and determine this. This is preparing athletic trainers to become professionals in athletic training and get ready for the workforce. So that is my flipped classroom method of teaching an athletic training class